of subphrenic artery. Suprarenal branch of renal arteries. Why there is a 3 arterial supply? Because this is endocrine glands. All endocrine glands in our body has more than 1 arterial supply, because their hormone they produce, it goes directly into the blood. That's why they need more blood. Okay, know this arterial supply, and the venous drainage through the renal vein and the subphrenic vein that forms the azygos veins, hemiazygos veins, like that. But this is important, that is the arterial supply. Okay, so now the zones that I'm going to give the name, and their functions. Cortex has 3 zones. Zona glomerulosa, zona fasciculata, zona reticularis. Zona glomerulosa outer layer, and it secretes a hormone. Oh, okay. It's also known as, it produces mineralocorticoids. And in mineralocorticoids, aldosterone is the main hormone. Aldosterone is the main hormone that controls the sodium and potassium in our body. Aldosterone always wants to store the sodium in our body, but sodium is salt, right? Do we need excess amount of salt? No. Okay, when the sodium is more in the body, we call Kuhn syndrome. Kuhn syndrome. That time potassium will go down, because the sodium and potassium are inversely related. So now, zona fasciculata is the middle layer. And it produces glucocorticoids. It produces the glucocorticoids. Example, cortisone, hydroxycortisone, etc. That controls, see by the name glucose. It increases the glucose level in our body. That's why diabetes patient, if they took their shot, cortisone shot, their blood glucose level goes up. Not only blood glucose, their heart rate goes up, respiratory rate goes up, sweating changes, mind setup is different. Okay? Zona reticularis, it is the innermost layer. And it produces gonadocorticoids. Example, gonadocorticoids, androgen for male, estrogen for female. Our adrenal glands also produce the gonadal hormones to maintain the female character, to maintain the male characters. Just understand, let me give you a little idea. I am a man, I have androgen, but I have also estrogen. So somebody is a woman, she has estrogen, right? But she has also androgen. But little. If there is a tumor, say I'm a man, if I have a tumor that producing estrogen, then what's going to happen to me? My male character will be changed into female. We call it womanly man. And when opposite, we call it manly woman. You are now getting little idea that how the gender switches. Okay. So now, this cortex is hypoechoic. Cortex is hypoechoic. Now, zona glomerulosa increase the, okay, when the aldosterone is increased, sodium is increased. This is a chemical symbol. We call it Cohn's syndrome or Cohn's syndrome. In Cohn's syndrome, the blood pressure goes up, sodium goes up, potassium goes down. Zona fasciculata. If the glucocorticoids is increase, that means increase the cortisone. Increase the cortisone hormone. When the cortisone hormone is increased, the name of the disease is Cushing syndrome. Cushing syndrome. You heard the name, right? Now, if the Cushing, if the cortisol level is low, we call it Addison's disease. So in Cushing syndrome, what you see? Moon-like face, hairiness, mustache, beard, and central deposition of the fat. The leg and the hands will be spindle, means fat free. And when the cortisol level is low, Addison's disease is opposite. Patient will be so skinny you can count the ribs in the chest. You can see the skin is bronze color. Skin is bronze color. And tuberculosis, you know the disease, right?
Mhm.
Tuberculosis is one of the major cause. You can say 90-95% Addison's disease is happen due to the tuberculosis of the adrenal gland. And Cushing syndrome, if you take the medicine, cortisone, prednisolone tablet you are eating because of the doctor gave some autoimmune disease, and you get moon-like face, obesity, all those things happen, blood glucose level goes up. Okay, and another one, disease. If there's a disease, what is that disease? I'm going to show you with a brief idea that, okay, let me do this. This is cortex and now medulla. In medulla is the innermost, right? If I draw the diagram of adrenal gland, so this is more brighter. Sonographically, you will see the medulla is more brighter than cortex. So this is medulla and this is cortex. Cortex has 3 zones, but you cannot differentiate. But you will see the cortex has like a kidney cortex, darker. Okay, cortex is darker, medulla is brighter, sonographically. And this adrenal gland, in the adult, we cannot see sonographically. The best modality for the adult is CT scan. But in children, neonates, and fetus, ultrasound. You can see the ultrasound. Okay, so now this medulla produce adrenaline and noradrenaline. Another name of the adrenaline is epinephrine. And another name of noradrenaline is norepinephrine. Okay, so now what is the functions of adrenaline and noradrenaline? They are the hormones. They keep our body fit for fight. Say you will be driving, right? It is not day, it is night time. But you are fit for the driving at night. Sometimes we drive in a highway or local way, there is no lights are there. Only the headlight of the car, right? We get feeling nervous, right? But our body will be fit. That no, don't Ayub, don't worry. Drive. There is no scary. Who is making this adrenaline or adrenaline? Stress and stress, flight and fight, they help us. Sometimes I have a big test tomorrow. Example, right? I'm so nervous. Who is making me to go to the exam room and taking the test? This. Okay, so now, who controls these hormone secretions? You need to know that. That is known as feedback mechanism. What time is it?
It's time. 7:54.
So now, we have hypothalamus. We have pituitary gland. Then we have adrenal gland. Okay? So now, hypothalamus, pituitary and adrenal gland, they are all endocrine glands. Hypothalamus is in the brain, just below the thalamus. Pituitary gland at the base of the brain, at the site of optic chiasma, there's two eye nerve, ocular nerve. And adrenal gland is that just we are discussing adrenal gland, the supraadrenal gland. So now, this adrenal gland produce hormones. These hormones level, if it is a negative in the blood, negative in the blood. So then what happens? Say this is in the blood. So this information will go to the hypothalamus as a negative feedback. That blood level of hormones decreases. So then hypothalamus will send the information to the pituitary. Pituitary, another name is the master gland. So adrenocorticotropic hormone will be released by the thalamus to excite the pituitary gland. Then pituitary gland say, what message is it? Oh, you know the blood level of hormone is reduced. So send informations to the adrenal gland by adrenocortico releasing hormone. Adrenocorticotropic hormone, ACTH, adrenocorticotropic hormone. No. Let me double check. One is the trophic hormone, another is releasing hormone. Yeah, pituitary secretes ACTH, adrenocorticotrophic hormone and adrenocortico-releasing hormone. Okay, and that's it. Adrenocortico-releasing hormone will excite the pituitary gland. For what? Hey, pituitary gland, send the signal to the adrenal gland by secreting the adrenocorticotrophic hormone. Because this hormone's receptor is present in the adrenal gland. When this hormone will come to the adrenal gland say, oh, this is a sign, this is a signal to produce more activities. So then when it will work on the adrenal gland, so adrenal gland will be excited. Then what going to happen? The hormone will be more
Positive.
So then this negative sign, there will be no negative sign. So negative feedback mechanism is gone. Okay? So this is known as feedback mechanism. So that's the way the hormone is balanced in our body. You got it? Good. So now pathology. A quick pathology. They will ask this question. I said about the Cushing disease, Cushing syndrome, additions and cones. Keep that in mind. Which hormone is responsible, which hormone is responsible. So then, another major pathology that happens in medulla. One is benign tumor. We call it pheochromocytoma. See the pheochromocytes, the name of the cells, they have tumor known as pheochromocytoma. And now there's another malignant tumor. Malignant tumor that is very important, known as neuroblastoma. Malignant tumor, benign tumor, neuroblastoma. This neuroblastoma is the second most common pediatric intra-abdominal malignant tumor. And who is the number one? Nephroblastoma or Wilms tumor. Okay, so now it is not only found intra-abdominal. Now neuroblastoma can found so many places, even the inside the bladder. Very rare inside the bladder they found. Okay, so now what are the other tumor you can see? Called ganglioneuroma. 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 What is that means? You need to understand a little that when the adrenal gland was forming, so this is the medullary part, inner side. There are some ganglion cells sympathetic ganglion. These are sympathetic ganglion. Ganglion is the group of nerve, sympathetic nerve cells. During the development, some of the cells from here, they migrate into medulla. That's why it is neurogenic, nerve cells. Medulla is composed of nerve cells. Because of the nerve cells, and it is hyperechoic. So now, ganglioneuroma is a benign tumor of sympathetic nervous system composed of mature ganglions. It's a rare solid mass. Okay, so know these three types of tumor. One is pheochromocytoma, is a benign, and malignant is a neuroblastoma, second most common. The first is Wilms tumor, and the third is a ganglioneuroma. Okay, ganglioneuroma is a benign tumor. So this is benign tumor. Okay, so this is in short about the bladder and adrenal glands. If you, oh, one more thing I have to tell you. Oh, I forgot. That is also board test question.
Cushing's?
Yeah, no. How you going to know the patient has adrenal gland tumor? So now, adrenal gland, there's a right and there's a left, right? And let me tell you, this is right-sided adrenal gland. And this is left-sided adrenal gland. Kidney is a retroperitoneal organ, right? Adrenal gland is a retroperitoneal organ. Pancreas is also retroperitoneal organ. You got it? So now, pancreas head is on the right side. Pancreas tail is on the left side. Just behind the head of the pancreas, IVC. Okay? So now, and behind the IVC, there is a adrenal gland.